Senior First Aid. Presentation by me, Janelle. What am I doing this presentation? In this presentation, I will share with you what I've learned in the Girl Scout Senior Badge First Aid. It is about knowing what to do in emergencies. So first, I learned about how to perform triage when several people are injured. In a major emergency, you'll have to perform triage to figure out the order in which you treat the injured. EMTs decide who to treat first in a mass casualty incident using a triage. So this is an example of a triage right here. A triage can have 4 or 5 levels, but in this example, there are 5 levels. The first level is an immediate emergency, like it has to be dealt with first. You have to deal with this person first. Level 2 is an emergency. Level 3 is urgent, but it's not life-threatening. Number 4 is semi-urgent, but it's not life-threatening. Number 5 is non-urgent, but the person does need to have treatment when it's like the perfect time. When EMTs treat a person who is injured, they do these procedures. They do a radial pulse, they check their wrist. They also check for capillary response, making sure the fingernail turns to normal color after 2 seconds. So they squeeze the fingernail, and you know how the fingernail turns white. If it turns to a normal color after 2 seconds, then the person is fine. But if the fingernail doesn't turn to a normal color for more than 2 seconds, then the person is losing blood. Also, please check the mental status. Ask them questions about the incident, like where did they get hurt, like where does it hurt, like did they get hurt in their head or in their neck, spine, whatever. So I also learned how to help a head or neck injury. First and most importantly, if you think you are dealing with a head or neck injury, call 911 immediately. Do not shake the person. Also, please check for breathing or if they have consciousness. Do CPR as needed, but you have to do but you have to do it a little bit differently. You have to pop the bottom of their jaw, so like you don't have to move the head or the neck, because like the neck and the head is fragile. If they have a helmet on, leave it on. You want to provide support with the head. As someone who is on with first responder, what do you do? Well, do you know how did the person fall? When you call 911, which is the first thing you should do, make sure you tell the caller how did the person get the injury, and does the person need CPR? So make sure to have those questions in mind as you're talking with the caller. Learn how to use everyday objects to make splints. Find something rigid to use as supports to make the splint, such as sticks, boards, or rolled up newspapers. If there is none, use a roll blanket or clothing. Keep the splint dry, as moisture can weaken the splint and cause skin irritation. Avoid scratching, as it can irritate the skin. And, excuse me, please check for signs of damage or skin irritation. So this is an example of a splint right here. Well, yeah, it's an example of a splint. Recognize the signs of drug overdose and alcohol poisoning. So this is a serious issue in the United States right now. It has been an issue for like a long time, and like it's so serious, and like it requires like a lot of medical attention. Drug overdose and alcohol poisoning is a serious issue that requires a lot of medical attention. You must call 911 if you see any of the following symptoms: vomiting, dizziness, or lack of consciousness. You also need to stay with the person just in case if they start vomiting. So, that's all I learned in Senior First Aid. Thank you for watching this video.